My name's Rachel and welcome to my vlog. So in today's video, my friends and I will show you how to perform a complete cardiopulmonary assessment through a game called Pass the Stethoscope. So whoever catches this stet will teach you or show you their knowledge about their cardiopulmonary assessment. So let's start with me. Okay, so first we'll be talking about vital signs. Vital signs composes of someone's temperature, heart rate, respiratory rate, and blood pressure. So first, temperature, you just use a thermometer to get their temperature. And their normal values are 36 degrees Celsius to 37.5 degrees Celsius. And then you just place it under the axilla and wait for it to beep. So at the same time, you could also be taking someone's heart rate or pulse rate. So this is the number of beats per minute you feel on any arterial pulse, in this case, the radial pulse. And usually, the normal values ranges from 60 beats per minute to 100 beats per minute. Next is respiratory rate. Respiratory rate is the number of breath cycles per minute. So during the assessment, the patient is unaware and you do this under observation. Normal values is 12 to 20 cycles per minute. So last, we'll be taking the blood pressure. So what we need is a stethoscope and a sphygmomanometer. The sphygmomanometer should be placed 2 finger breadths above the crease of the arm, right here, and it should be snugly fit. And then place the stethoscope over the brachial artery, and don't forget to ask the patient their baseline. I hope you understood vital signs. Let's see who's next. Hey, it's me again. This time, I'll be talking about pulsations. So what you have to do for pulsations is listen for the heartbeat. Listen for the heartbeat. Palpate for the radial pulse here on the wrist. And you're going to have to fully assess this for 1 minute. So after that 1 minute, your heartbeat and your radial pulse should beat synchronously. If not, they are called skip beats. In that 1 minute, you have to count how many skip beats there are. You need to see if it's regular, irregular, if it's boundy, boom, 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 or if it's thready. Okay, did you get it? Good.
Thank you, Richie. Hello, guys. I'm Asling Julian. I'm going to discuss about how to grade angina and dyspnea under cardiopulmonary assessment. Angina, in simple terms, is chest pain. In the cardiopulmonary assessment, we observe the patient and we have an anginal scale ranging from 1 to 4. We document 1 plus as light, barely noticeable, 2 plus as moderate and bothersome, 3 plus severe and very uncomfortable, and 4 plus for most severe pain ever experienced. On the other hand, we have dyspnea. It is the shortness of breath. Like angina, it does also have a dyspnea scale ranging from 1 to 4. We document it as +1 if it is mild, noticeable to patient but not to observer. +2 if it is mild, some difficulty, and noticeable to observer. +3 if it is moderate difficulty but the patient can continue with the task. +4 if it is severe difficulty and the patient can no longer continue. So these are the following portrayals of anginal scale. For 1 plus,
Your pain experienced. Ah.
These are the portrayals of dyspnea scale. Kurt, nice one. Bigay mo yan. Last two. Kuya Saron, kanina ko pa hinihingal ah.
Kaya pa.
Last three. Kaya mo pa ba, Art?
Oh, kaya pa.
Last four. Hey, Bench, kaya mo ba?
Hindi na. Hindi ko na kaya.
Kailangan ng tubig.
Hindi tubig.
So guys, nagets niyo ba ang anginal and dyspnea scale? Good. Now it's time for the next assessment.
Thank you, Aslin. So, hi, I'm Jed, and I will be teaching you how to assess for breathing patterns. So, what's important to remember is CARR, C-A-R-R, which stands for character, amplitude, rhythm, and rate. So, let's start first with amplitude. Amplitude of a breathing pattern can either be shallow or deep. While for the rhythm, it can be regular or irregular. Lastly, for the rate, it was explained a while ago during the vital signs, but to give you a recap, normal values range from 12 to 20 cycles per minute. And lastly, for the characteristics, here are some patterns of breathing.
Eupnea, where there is a normal rate and depth as well as a regular rhythm. Bradypnea, where there is less than 12 cycles per minute, a normal or a shallow depth, and a regular rhythm. Hyperventilation, where there is a fast rate, increased depth, and a regular rhythm. Hyperpnea, where there is a normal rate, increased depth, and a regular rhythm. Tachypnea, where the rate is more than 20 cycles per minute, a shallow depth, and a regular rhythm.
You get it? Who's next?
Thanks, Jed. Hi, I'm Kurt. And for my part, I'll be doing the auscultation. Well, a part of it. So I will be performing the assessment of the heart sounds. So before we start, we need a patient. Siyempre, hanap tayo ng patient na cooperative, di tayo iiwan, or di din tayo pagpapalit. While going back, we have to wait. Hi sir, you look like someone who needs a cardiopulmonary assessment. So sir, I'm Kurt and I'll be your PT for today. So sir, okay na po ba? Proceed tayo sa treatment area natin. Okay. So before we start, make sure that the patient is assessed in a quiet, cool, and comfortable place. And always, always, always listen to his or her heart sounds. Oo, listen. Medyo mahirapan ka lang dito kasi never mo naman ako pinakinggan. So, sir, comfortable naman po ba tayo? Sir, before po tayo mag-start, okay na po ba if paparemove po natin yung shirt? Okay. Tulungan ko na po yun. Take note guys na pag papabarin natin yung patient, magpapaalam tayo. Di tulad ng iba, di nagpapaalis ng walang paalam. So, before we start for the auscultation, dapat alam na natin ang 4 na landmarks which represent each valve of the heart. So, better if ituturo ko lang sa inyo through rap. Art, tulungan mo naman ako.
1, 2, 3, and put man put man 22 45 22 33 right left 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 right left x x x x x to see x to see how
Alam na natin ang 4 na landmarks kung saan tayo mag-auscultate. So, proceed tayo sa assessment. So, sir, start na po tayo. Remind ko lang po before we start, inhale through our nose and exhale through our mouth. Okay lang po sir, relax lang po, okay? So, So, sir, based sa assessment, normal naman po yung mga narinig nating heart sounds kanina. So, sure naman ako guys na alam niyo naman yung normal heart sounds, which is...
Ngunit maaari din nating marinig ang mga sumusunod na heart sounds tulad ng ito ang tinatawag na S3. Ngunit normal naman ito sa mga bata. Ngunit sa mga matatanda, maaari itong mag-ugnay sa CHF o tinatawag natin congestive heart failure. Pwede rin natin marinig ito. Ito naman ang tinatawag na S4. Stenosis can also be heard besides the discussed extra heart sounds, in which there is an abnormal narrowing of passage in the body. Regurgitation, on the other hand, is caused when the blood flows back through the valve as the leaflets are closing, and it sounds like this.
So, I'm done with my part. I hope you guys enjoyed and learned a lot. Guess who's next?
Thanks, Kurt. Hi guys, I'm Utya, and for my part, I'll be doing the second part of auscultation, which is the breath sounds.
Okay, so first, I'll be teaching you where to place the bell of the stethoscope during auscultations.
When assessing for the apical segment of the upper lobe of both the right and left lung, immediately place the stethoscope above and below the clavicle or immediately lateral and below C7. For the anterior segment of the upper lobe of both the right and the left lung, place the stethoscope between the clavicle and the nipple area. For the posterior segment of the upper lobe of the right lung, place the stethoscope at the root of the spine of the right scapula. Middle lobe of the right lung, place the stethoscope medial and lateral to the right nipple. And for the lingula of the left lung, place it superior and inferior to the left nipple. For the superior segment of the lower lobe of both right and left lung, place the stethoscope medial to the scapula, between the root of the scapular spine and the inferior angle of the scapula. For the anterior segment of the lower lobe of both right and left lung, place the stethoscope immediately lateral and below the nipples. For the posterior segment of the same lobe of both right and left lung, immediately place it medial and inferior to the inferior angles. For the medial segment of the lower lobe, there are no landmarks for the right and left lung. Lastly, for the lateral segment of the lower lobe of both right and left lung, place it in the mid-axillary line immediately below the scapula.
Well, I'm sure you guys know what a normal breath sounds like. Also important to take note are the following adventitious breath sounds, such as rails or crackles on inspiration, friction rub heard on inspiration or expiration, squeezes more heard on exhalation, stridor on inspiration, and lastly, bronchi. There you go. Now let's start with the demonstration. Okay, sir, just remember to inhale and exhale normally. Now we proceed with the next assessment, which is the voice sounds. This assessment asks the patient to repeat the following words: 99, EE, 99, or whisper the word 99 while auscultating for each lobe of each lung. So, let's start. I want you to say 99 EE and 99. Or i-whisper nyo po yung 99.
99 EE. 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 99 EE.
Okay, thanks Mocha. I'm Pam and I'm going to be teaching you how to assess for the mediastinal shift and the tactile fremitus. So we'll go find a patient. Sir, before we begin, can I ask you to remove your shirt? So what we'll begin with today is tactile fremitus. Tactile fremitus is when the vibration produced by the voice is transmitted to the chest wall, where it is detected by the hand as a tactile vibration. So we'll begin with placing the ulnar aspects of both hands firmly against three areas. First, over the sternum, and then we ask the patient to say 99.
99.
And then we move on to the second area, which is under the nipple or on the costal area, and we ask the patient to repeat the word 99.
99.
Now that we're done assessing the anterior portion, we go to the posterior area and we ask the patient to turn around. So what we need to palpate for is the inferior angle of the scapula, so we just look for that. And once it is found, we place the ulnar aspects of both hands firmly against the chest and ask the patient to repeat the words 99. Once the palpation is over, the therapist must note any inconsistent or irregular vibrations felt. Now we move on to the mediastinal shift. Mediastinal shift is palpating for the position of the mediastinum by virtue of the tracheal location. We start by palpating for the sternal notch and then moving upward to find the trachea, to find its position. Usually, for conditions such as atelectasis, lobectomy, and pneumonectomy, the direction of the shift is ipsilateral to the affected lung, while for pneumothorax and pleural effusion, the direction of the shift is contralateral to the affected lung. Okay, so did you guys get it? Okay, thanks for listening. I'll pass you on to the next guy.
Check pala kayo. Ako nga pala si Art. So, nakikita niyo nasa akin yung stat. Galing kay Pam. Thank you, Pam. Okay. So, medyo busy ako ngayon. Pero, since nandito na kayo, turuan ko na rin kayo balik dito sa ginagawa ko. So, yung tawag dito is yung na-assess ko yung chest symmetry and mobility. So, mamaya i-assess ko rin yung chest expansion. Okay. So, ano nga ba yung chest symmetry? So, yung chest symmetry, check ko yung pag-inflate ng lungs, yung upper, middle, and lower lobe. Bale, ginagamit ko yung kamay ko. So, para i-check na yung pag-inflate sa iba-ibang landmarks. Kasi meron tayong tatlong landmarks. Sa upper lobe, dito, nakahawakan sa taas ng clavicle. So, sa upper lobe. Tapos, sa middle lobe, dito naman sa line ng xiphoid process, punta tayo sa gilid. Ito na yung para sa middle lobe. Lastly, sa lower lobe naman, yung subcostal margin. Ano ang subcostal margin? Dito siya sa pinakababang part
ng ribs na mapapalpate. So kapag once na-palpate mo, ito, dito ang subcostal margin. Okay. So, yung assessment nito ay may two parts. Mainly, yung unang part ay papahinga lang ang patient yung normal. So, yung usual nila ng paghinga, yun ang instruction. Tapos yung pangalawa is deep breathing naman. Inhale ng malalim, buga ng malalim. So, ang instruction para sa patient sa paghinga ay hihinga sa ilong, exhale sa bibig. Okay. So, pwede na tayo mag-start. Okay. So, sir, dito po muna tayo. Hinga po kayo ng normal. Okay. Okay. Exhale. Hingang malalim. Exhale. Okay. Good. Okay. Dito naman tayo sa may dulo. So, pag-process ulit. Line. Gilid. Okay, sir. Hinga. Normal. Exhale. Hingang malalim. Bugang malalim. Okay, good. Last, sa subcostal margin, lower lobe. Okay. Okay. Sige sir, hinga. Exhale. Hinga. Exhale. Okay, hingang malalim. Buga. Malalim. Okay, good. Okay, so base sa nakita natin, normal naman yung chest symmetry. Bali, napalpate. So, next part is yung chest expansion. Sa chest expansion, gamit tayo ng measuring tape. Sa measuring tape natin, meron two sides, inches, tsaka cm. Gagamitin natin inches. Kasi, based sa studies, ang nakitang normal value para sa chest expansion ay 2 to 3 inches. So, ano yung 2 to 3 inches na yun? Yun yung difference between dun sa paghinga ng malalim, pag nag-expand yung chest, tsaka pag nag-exhale na, kapag lumiit na yung chest. Okay, so makukuha natin din yung measurement. Yun yung kukunin nating measurement ngayon sa tatlong areas, tatlong landmarks. Una, sa axillary line yan. Gawa tayo ng line dyan, dyan natin ilalagay yung tape measure mamaya. Tapos, pangalawa sa second part.
Sige, cut na doon. Pangalawa
Sa xiphoid process. Okay? So, line ulit, ikot. Tapos, last sa subcostal margin ulit. Parang kanina lang sa chest symmetry. So, ang instruction natin sa patient ngayon ay hinga siya ng malalim. So, mag-expand yung chest at mag-exhale siya ng malalim. Okay? Tapos, delete na yung chest. Tapos, kukunin natin doon yung measurement. Okay? So, pwede tayo mag-start. Sige, sir. Ikot ko lang itong measure. Axillary. Yan. Okay, yan. Yan lang, sir, ah. So, yung malalim. Exhale na malalim. Okay, sir. Yung malalim ulit. Exhale na malalim. Okay. So, normal naman. Next, xiphoid process. Okay. Sige. One, two, good. Exhale, exhale. Okay, so sige na. Malalim. Exhale. Okay. So, 2 inches. Malapit sa 2 inches. Last, sa subcostal margin. Ayan. Sige, sir, yung malalim. Exhale na malalim. Okay. So doon nagtatapos yung assessment. So, nakita natin na normal naman yung chest symmetry and expansion niya. Okay, so tapos na ako. Bibigay ko na yung stat kay Sarod.
Thanks, Art. So, ngayon ako si Christian. So, next na namang di-discuss is percussion at cough assessment. So, let's start sa percussion.
There are three types of sounds in percussion: resonant, hyperresonant, and hyporesonant. Resonant. This is a low pitched and hollow sound produced during percussion. Hyperresonant is a loud, low pitched sound which indicates excessive air in the lungs. Hyporesonant is a soft, brief, and high pitched sound which indicates less air in the lungs.
So, start na tayo ng demo for percussion. So, ang gagawin natin is we're going to palpate for the intercostals, and then lalagay natin yung fingers natin on the intercostals, and then tap using our middle and index finger of the dominant hand. Tapos, papakinggan natin ng malapit para marinig natin. Tapos, compare natin sa other side, tsaka sa likod. So, tapos na tayo sa percussion. So, ngayon naman, yung gagawin natin is cough assessment. So, pero before that, ito yung mga gradings for cough strength.
Functional. The patient is able to expel sputum and able to cough normally. Weak functional. The patient has difficulty in expelling sputum but has a normal cough. Non-functional. The patient has a difficulty in both coughing and expelling sputum. 0. The patient is unable to cough and unable to expel sputum.
Yung cough assessment, ang gagawin natin, yung una, papakough natin yung patient twice, hawak niya yung kidney basin. Yung first one is trial, yung second one is to check kung productive or non-productive yung cough ng patient. Sige po, cough po kayo. Huwag niyo po kalimutang idura kung meron po kayong dudura.
Go.
Sige sir, cough po kayo 2 beses, tapos yun po yung gagamitin natin for assessment. So sir, ang gagawin po natin is uubo po kayo 2 beses, and kung sa second cough may na-feel po kayong lalabas, iduraan nyo lang po dito na gagamitin natin for sputum assessment mamaya. Sige po, ubo na po kayo. So, tapos na tayo sa percussion at cough assessment. Yung next naman natin gagawin is sputum assessment. So, tapos na tayo sa percussion at saka cough assessment. So, let's proceed to the last part.
Thanks, Daniel. So, pangalawa kay Benjo, ang gagawin natin yan is sputum assessment. So, ang sputum assessment, ginagawa lang pag merong productive cough. Kasi pag productive cough, ibig sabihin may sputum yun. So, ang 4 na tinitingnan dito is code. So, 4 yun: color, odor, amount, and texture. So, simula tayo sa color. So, ang color, pag nakita mo yung certain na color na ganito, pwede siyang indicative ng isang disease. So, may table tayo para doon. So, show namin sa'yo. Ito next. So next is odor. So may dalawa lang namang odor na pwedeng maamoy. It's either foul or sweet. Pag foul, it's indicative na merong infection yung patient. Pag sweet naman yung amoy, pwedeng may pseudomonas. So next is amount. So normal amount ng sputum na ilalabas ng patient mo is 100 ml or considered yun na 2 tablespoons. So if less than that yung amount makuha mo, pwedeng dehydrated yung patient. And the last is texture. So texture, same din sa color. Pag ganito yung texture na makita mo, pwede rin indicative to ng other conditions. Papakita din namin yung table next. So meron po tayong patient dito na kakatapos lang ng cough assessment. So i-assess natin yung sputum niya. So okay. So yun, pag kukuha nyo, checkin nyo yung color, tsaka yung texture. Tapos nun, para mag-check ng odor, papaamoy nyo doon sa patient, hindi kayo aamoy. So yun. Sir, paamoy po, tapos describe po saan ka naamoy.
Medyo matamis yung amoy dyan.
Okay. So tapos na po tayo sa sputum assessment. Next na is hydration. So labas po tayo, dun ko lang i-demonstrate. So for the final assessment ay hydration. Maghanap po tayo ng mga tao, tatanungin po natin sila kung ilang baso tubig iniinom na nila everyday. So yan po, tingin po tayo, let's go!
naman po na para 7 to 8 classes. Normal, okay. So, okay po yun. So, thank you ma'am. Important ako. Thank you. Ano pa tayo? Dalawa. Sobrang unti po na yung inom niya. Alam niyo po yung normal. Pwede yung 8. No? So, try niyo po 8. Diba? Ito yung coach pa rin. So, yun po. 8, 5, 2. Subuhin po yun na marami para healthy. Diba? Thank you. Baso ng tubig.
Hindi po baso, nasa
Sa bote. Ilang bote? Tatlo kayo. Ilang baso ng tubig ba yan?
mga 300 ml.
Ayos yun. So, pag glasses naman, alam niyo naman po yun. So, yun naman po, mapasok naman po kayo sa tatlong salamat po. So, that ends my part. I hope you learned something and I'll give the floor back to Rachie.
So that ends our cardiopulmonary assessment. Thank you for everyone who joined this video. I hope you guys learned a lot today. Signing out with Group 3.
Bye!